Let's walk through a typical feeding procedure from start to finish. It is simple and logical. It'll be second nature to you in no time. Before you do anything else, wash your hands every time. This is very important. Before feeding, use a small amount of water to flush and pre-lubricate the extension set and tube. Be sure you check the Mickey feeding tube before each feeding to make sure that it's still in position. It's a simple procedure. For details, consult your guidebook or ask your nurse or doctor. Now that you've done the prep, let's see how a feeding setup works. Just follow these steps. Using the appropriate extension set as your doctor has directed, connect the extension set to the Mickey feeding port. Align the black line on the extension set connector with the line on the feeding port. Push it into the anti-reflux valve and turn it clockwise. To disconnect after feeding, realign the black lines and pull out the extension set connector. If your doctor has prescribed continuous feeding, connect the continuous extension set to the stepped connector from the feeding bag with a firm push and twist. Wetting the stepped connector before insertion may provide a more secure connection. For bolus feeding, connect the bolus extension set to the catheter tip syringe with a firm push and twist. Finally, your doctor may have recommended that you check for proper placement before each feeding. For more details on how to do this, refer to your care guide or contact your healthcare professional.